And good morning. It's November 7th, 2023. I'm Dr. Deuk Majan, CEO and founder of the Deuk Spine Institute, pioneer of the Deuk plasma rhizotomy. Our patient here travels from Brooklyn, New York with 14 years of neck pain. He's got two problems, facet joint pain, discogenic pain. They both treated separately. We're first going to treat the facet joint pain. He has pain with rotation of his head, looking over his right shoulder. It's localized to the facet joints at C5-6 and C6-7. So we're going to start our day by performing a Deuk plasma rhizotomy on the cervical spine, right side C5-6, C6-7 facets. What we're going to do is denervate those facet joints, meaning we're going to kill the pain from those joints. All right, so let's get started. We start by accessing the facets using a needle, and I'm going to put some numbing medicine here just so it's not too uncomfortable for the patient. He is asleep. You can see the tube. He has an endotracheal tube. Now we need him asleep because we're going to be flipping him over in a minute as soon as we're done here, and we're going to be doing the Deuk laser disc repair at C5-6 and C6-7. So we've made our incision. It's 3 millimeters. Now I'm entering with my probe. And this is the rhizotomy probe. We call it the rhizotomy probe, and it's very powerful, unlike a radiofrequency ablation. Radiofrequency ablations, unfortunately, are sort of what everyone else is doing. They don't last. They don't work well, and they certainly don't last. We found that this procedure does last. It lasts permanently. The reason is simple. We're actually destroying the pain nerves to the joint. All right, so I need to go a little bit more to the side. How is he doing? Shot? All right, that's better. Is there a screen I can look at without looking over my head? Shot? Very good. All right, so there's T1, 7, 6, 5. I'm heading up to 5 right now as we speak. And the key here is you want to get onto the bone of the spine. And that's what I'm trying to do, get onto the bone. Easier said than done. You have to get through the fascia. Shot? All right, perfect. So we're going to start here. There's T1, 7, 6, 5. I'm right at 4, 5, it looks like. Shot. And you want to be right where I'm at with the tip. It's the lateral mass of the spine. It's right where the nerves come from around the side, and they actually wrap around the lateral mass and innervate the facet joint. Now you can see right now I'm at 5, C5. I could feel the arthritis in the C5-6 facet joint. It's really bad. I just went over a huge bone spur. Any questions from our audience? Once again, we're treating facet joint pain on the right side at C5, C6, and C7, where he's having facet pain. And this is in addition to his disc problems he has. Shot?
No current questions, but we do have a comment from Mary on Facebook.
All right.
And they just says, good morning.
Good morning, Mary. Thanks for joining us. And before I do any of the burning of the nerve, I always want to reposition my bovie, and then check with the x-ray to make sure I'm in the right place. It's easy to find yourself a little too much to the midline or a little too much to the side with this particular procedure. So you want to verify where you are before you do any burning. And it's also important to stay right on top of the bone while you're doing it. The nice thing about the procedure is we know where the pain nerves are, at least the area where they are, and we basically are burning in a field, in an area that's about 300 millimeters squared per facet. It's a pretty big field. Sorry, not 300, about 100 for the cervical facet. Shot? All right. Heading down to our last one, which is 7. Now the patients that have this procedure, they do have soreness in their muscles afterwards. It's normal. Some of them will actually have a sunburn feeling in their neck, on the skin. And that sunburn feeling can last for a few weeks. Once again, I'm feeling the bone. I'm feeling where the nerve is coming around the waist of the lateral mass. And that's where I'm doing my burn. I've done enough of these surgeries, posterior cervical laminectomy and fusions. I know the anatomy quite well. And really it's a safe procedure as long as the muscles, you're really just going through muscles. That should do it, okay? So at this point we're done. We've rhizotomized or burnt the nerves coming around the right side at C5, C6, C7. Let me show you the incision. Can you guys see this? We're just putting a little pressure. Let me know when you can see, Henry.
Yes, sir. Yes, we can.
All right, so you can see it's about a 3 or 4 millimeter incision, and it's right over where he identified his neck pain is. So that's it. It's a pretty quick surgery. We're going to flip him over. We're going to come back and fix 2 cervical disc herniations. So come back and join us then. Thanks, Henry. You can end the broadcast.